So I prefer this because I can concentrate on you. Gabe, leave it. Come on.
Bye.
Bye, lovey. Like to go and watch the fish?
Yeah.
Sure. Come here. Yes, bear this in mind next time. Okay. Okay. Now tell me, what is your single most important problem I can take care of today?
Leg swelling and still frequent urination.
Okay. Leg swelling and what?
Frequent urination.
Okay, good. Okay, if I can only have a look at your legs and the feet if you take your shoes off too. Thank you. And the socks off, Jesus. Come on, sit down. I want to check if you got a swelling of the ankles, okay? Now if you have swelling of the ankles, you can't see this. So you don't have any swelling of the ankles. And you can't have swelling of the legs without the swelling of the ankles. Because the swelling of the ankle starts first and the second. Okay? Also, if I press like, if I press like this and it doesn't leave a dimple, then it's nothing to worry about.
Okay. It's usually just this one thing. It happens at nighttime. I have to prop up my legs because it gets so bad.
Okay, come and sit down. That's nothing to worry about. We only worry about if there is a dimple when we press, okay? Now, the feeling of swelling of the legs will go if you somehow manage to lose some weight, because it's connected with your weight too. Okay. So, Ashley, where did you go away for the long break?
Huh?
Did you go away any for the long break? Or stayed at home?
Stay at home.
Okay. Now, I've had a letter from insurance already. They may stop your insurance because of the whole the abuse of emergency department.
I don't understand why that's an abuse of the emergency department. Would you have rather came in? One question to you.
Okay.
Do you guys administer, can I please stop? Do you guys administer IVs? I had to have 2 bags of fluids. Is that in the emergency room report?
You had to have 10 IVs and the administration of the thing, because that particular problem could be looked into at the office if you attend the office. That is the note, that certain conditions could be taken care of at the office.
So, what you're saying, I was passing out, I couldn't really regain conscious, I couldn't walk, I seen tunnel vision, which everything went black, and I was actually fainting. He wanted me to come here instead of go in the ER when I could have possibly died due to dehydration.
Because
I found out it was actually...
Got plenty of time to explain to you. You can justify this to Medicaid, and they've already written a letter to me. We administer IV fluids here. Okay? The emergency room isn't the place to administer the IV fluids. Okay? We do administer IV fluid here. Now, before you get dehydrated, you have warning. You don't get dehydrated overnight.
But I was also donating plasma, and I was trying to keep up with my intake and fluid. I guess I wasn't, and I ended up fainting. And I really don't like it how you're threatening me, saying I'm going to lose my Medicaid when I'm actually coming to help for you.
I am not telling you, I'll repeat that. I said you may use your Medicaid because of the emergency room visit. It's the hospitals are keeping an eye on patients who could be treated in the clinic. Do you understand my plain English, whether you like it or not? The second thing is your insurance, which is a private, what a Medicaid insurance, it sends us letters that certain conditions could be taken care of in the office, in the clinic setup. It's not my regulations. I'm telling you this because
And also one
would
thing
you
though,
please not interrupt? I'm telling you this because if this happens frequently, then they'll take your Medicaid away.
but my thing is to you, see, I didn't have transportation. I don't have a car. The hospital is right next to me.
That's most of the time is the case for transportation.
So how would I get here if I don't have
Medicaid,
transportation?
Medicaid is not going to provide you with transportation.
Okay, then how would I go there when I'm severely dehydrated, fainting, about ready to pass out? How would I come here?
That doesn't happen overnight.
I know, but throughout the time, what I'm saying is, I've been donating plasma.
That thing is a limit to donating plasma.
Yes, it's 2 times a week.
Then if you cause your own illness,
I stopped doing it because of that.
Okay, if you 2 times a week, nobody does do that. For whatever reason, you donate the thing, that's not the right thing. If the disease is created by the patient doing something which is not right.
Actually, plasma is made up of 98% of water.
I'm not quite aware of that protein, but if there isn't enough protein in the blood, it wouldn't retain water either, and your blood pressure will drop.
So isn't that a cause to go to the ER?
No, it isn't.
Even if
in
you're
the first
fainting.
place, you cause.
So
in
what
the first
is?
place, can I just finish and I'll give you time to talk? Okay, I'm quite willing to look after the patients. I'm doing my duty by telling you that if the patient causes a fainting spell, there is no reason to go to ER. If he had stayed at home and had fluids,
I
as much
wasn't
as he
taking
can,
with fluids.
and given some time, then it would have gone. This is self-treatable condition, not an emergency room
Okay,
physician.
so what you're saying with any type of dehydration, it should be treated just at home. If you're even severely dehydrated, you should stay home. Just basically like saying if you get sun poisoning, it's your problem, so you shouldn't do anything about it.
Okay. If you're clever enough, I'll tell you this. If this happens again, I'll discuss the case, which I've discussed this case already with the emergency room department, and I'll send a copy of the recommendation of the ER, whether it was dire emergency or not, whether it could have been prevented at home, and sent to your insurance company. Okay?
So you're threatening me again.
And then you can discuss with your insurance company. I'm just telling you for your own good. Your insurance company is keeping an eye, not only on you, on all the patients on this insurance regarding the emergency room visit. This is why we have days when we see patients, all days, patients without insurance. This insurance company has required your doctor to cover a patient 7 days a week. Over the weekend, you can use your common sense. Nobody runs for little problems, okay?
That wasn't a little problem, I'm sorry.
A little problem. You can argue with this, okay? But today I'm going to write a letter to your insurance company. Nobody can stop me.
Okay. And I will report you to this administration office for your unprofessionalism.
That's the usual thing.
The usual thing?
Yeah.
Oh my gosh. The usual thing is where you sat here with my grandma and you wanted to take care of her more than me and focus on my problems. The first thing you did was threaten me and say that I might use my Medicaid. How professional is that?
That may be,
I came here to you for help.
Excuse me, I've finished the visit. Have a good day.
All right.
All right. What's
And you were here by your administrations.
To your right, please. That will take you to the clinic. Have a good day.